Bismillahirrahmanirrahim. Our today's topic for dental material class is requirements of dental cements for lining, base and luting application. All of you well aware with the terms lining, base and luting. If not, then we will see it here in this lecture. Cement. What is cement? Cement is a binder or sealer. You can bind something or you can seal something with the material, and the material which used for binding or sealing is called as cement. In dentistry, cements are used for cavity lining and luting also. Others are using for restoration or filling a cavity. What is a cavity? In simple terms, a depression due to any mechanism on the surface of a tooth is called as cavity. But it will be a pathological cavity due to mechanism which causes pathological effect, not physiological. Physiologicals are pits and fissures. And simply cement used to join in our household or in daily life. Cements, we are using cements to join anything. And again, it is supplied as two components which will be mixed for use. So requirements: filling materials due to some circumstances can't be used directly. So when we have such a problem, then a cavity lining material must be applied over pulpal or occlusal floor. Pulpal floor, which is toward the pulp. It can also be called as occlusal floor. Now, pulpal axial dentinal wall in case of class 2 cavity. What is this? This pulpal axial dental wall. So, if this will be a tooth and देसी अंग्रेजी बीमार है ना हम. This is the class 2 cavity. Here this area is destroyed by any mechanism. So what we have to, अच्छा सा कलर ढूंढे. So pulpal axial dentinal wall. 1 minute. So pulpal axial dentinal wall. So this is the pulp. Clear? Now we have to move towards the pulpal axial occlusal wall. If our cavity, if we say that we have designed this type of cavity, we crossed the areas here, so I think we must go there. So if This will be our cavity designing. So it is the pulpal wall. This is the axial wall. It is also called as occlusal. So pulpal, axial, dentinal wall. These are the two walls. One is, you can say, occlusal, and this is axial or pulpal axial. All other things are the walls. These two walls are away from your pulp tissue. So these are not the pulpal walls. Clear? So this will be our this. This area is our pulpal occlusal. Sorry. Pulpal occlusal or pulpal axial dentinal wall. Now, sorry. This area is our pulpal axial dentinal wall. Now, why pulpal axial dentinal wall should be lined? To protect pulp tissue. Now the requirements depends upon depth of the cavity and the type of filling material. And what are the purpose of lining and bases? Lining or bases acts as barriers, and Pakistani peoples are well aware of barriers. All of you know what are barriers. So in dentistry, the barriers between dentine and filling materials are required, because I already described that dentine can transmit or transport chemicals to the pulp tissue. Now, barrier is of three types: thermal, chemical, or electrical. It also must be resistant to disruption and must also provide a firm and rigid base. Now, the thermal barrier. Thermal barrier, as obvious from the name, that it protects from hot or cold changes, thermal changes. It must be insulator, thermal diffusivity and conductivity should be blocked by this thermal barrier. And it is mainly required for a metallic filling, especially in deep cavities, to prevent thermal shock. Then in case of dentinal pins, as I have shown you, this cannot be achieved. In shallow cavities, less important. इधर वो pins पड़ी हैं बेटा, था देना मुझे, एक डब्बी से मैं लेके आया था. In shallow cavities, it is less important. Varnish is sufficient, especially for amalgam. So if few people want to see the dentinal pins, sorry, these are 24-carat gold pins. I'll show you. I want to show you these things. Yes, it is this thing. Sorry, this one. It is the handle of that pin through which we can torque it or we can fix it. These small pins are there. These are gold pins, and this is this one. I think I'll show you through manually. Sorry. So one by one. This is the engine driven bit or burr through which we can make a hole in the tooth. You can see drill. It is engine driven. You can see the uh, structure which is made for slow piece hand piece. This one is the handle with the slot in it. You can see, and this is the pin, the gold pin, threaded. If I can show you people the threads, you can see these are. And now I'm going to fix it in this. Now, sorry. You can see now this is attached to this. So now we can thread it through this handle easily by rotating it, the handle. So these are the dentinal pins. Many types nowadays, stainless steel, fibers, and even titanium pins are also available. And you can make your own pens through CAD/CAM. So the thermal barrier in case of these dentinal pins, which we are going to thread into the dentine, cannot be achieved because we cannot put any substance in between dentine and these pins. If we can make a hole which is larger enough, then this can be possible, but it is much difficult. So in shallow cavities, there will be no need of any thermal barriers. Oh, and varnish is sufficient in shallow cavities, and especially for amalgam, mean in shallow cavities for amalgam. It's not for deep cavities which are filled with amalgam and we are going to use varnish. Now, what is cavity varnish? Cavity varnish is natural or synthetic resin in a volatile solvent. It is painted at the cavity walls and base. Cavity walls and base I have already described. Solvent. Already you people know that What is the solvent? It produces a thin layer of resin which seals dentinal tubules. Is it true? Solvent can produce a thin layer. How? Solvent produce a thin layer of resin. How? Solvent takes the resin, because solvent are mixed in a resin. Solvent goes to chase water as already described, and then it evaporates, or it carries the resin layer, and this resin layer seals the dentinal tubules. Solvent evaporates and resin swell in the presence of water. Now, beneficial for amalgam fillings because it forms marginal seal. Especially for amalgam. Some filling materials liberates heat on setting. As already described, that acrylic resin is producing up to 10 degrees centigrade for cold cure. Cold cure means for chemical cure, and some light cure, they produce heat as much as 15 degrees centigrades. Now, chemical barriers, protection against chemicals of filling materials like acrylic monomers in resin-based materials, phosphoric acid in silicate cement, although it has no effect nowadays. Effective marginal seal is essential due to achieving an adhesive bond at the tooth restorative material interface. Now, the electrical barrier. This similar metal fillings can cause galvanic effects. Already you people know about that. Galvanic cell produces electric current, which ultimately resulting pain and accelerates corrosion also. Polar organometallic compounds are present in varnishes. And less polar resin containing varnishes are also there. Now, polystyrene used as electrical barrier. Polystyrene, which should be painted on metallic surfaces for temporary relief, not a permanent one. Now, if we go for clinical consideration, varnishes are usually water soluble. Bases, we also can say. Setting reaction is exothermic. So water-based varnishes or bases are not ideal insulators. If we see the strength and flow, lining material should remain intact till placement of final restoration, because we have lining material, then base, and then the final restorative material. The degree of set achieved at the time of filling material is placed is of important. Strength of the set material and its thickness, type of the cavity, the pressure exerted during the placement of the filling material, which we have seen in the chapter of amalgam, the degree of support from surrounding structures, and the choice of correct operative technique, as we have seen in the chapter of amalgam. Now, effect of set material. As you can see, this is the lining and this is the amalgam, and we are going to press it. This is a class 1 cavity. Dentine is fully supported, class 1 cavity, and it is fully supported with the dentine from the sides. And it is a fully setted lining material. If it is not fully setted and we are going to press it, then what happens? Then amalgam goes down, flow of an unset cement lining caused by high pressure. So lining material is not set and we are going to press. What will happen? The lining material should go or will go towards the sides, and the amalgam will contact directly to the base of the cavity. This is the base of the cavity. Now flow and pressure, again, as we have described, same thing happens here, that it is the matrix, this is the lining material, we are going to press it. So what is going? Again, the pressure exceeds, it will disrupt or will push the lining material towards the sides. And if thin sections are there, what will happen? Their pressure is more and it push apart the lining material, push due to the excessive pressure. Here, if lining is thin, then what happens? Again, which we have seen in the previous one. But here, a thin lining also present in the at the base of the occlusal part of the cavity. So these are the effects of flow and pressure and setting of the material or set material. Effect of set material and flow and pressure. Now, fracture of lining, it is also described in the chapter of amalgam. When condensing amalgam, class 2 cavity, cement wall or lining at the axial wall, which already I have described. If we are going to put much pressure at this area, then what will happen? It will fracture. So to avoid this, we have to fill this area first and then come to the other area. Now, other materials are not much problematic, which are encountered with amalgam condensation. All the examples which we have seen, these are of amalgam condensation. Other material have not much need much condensation or other things. and much smaller forces are needed for their adaptation for other materials especially. Now the radiopacity and compatibility, all of you know about the radiopacity and compatibility. Ideally, the lining and base materials are radiopaque. That is, they appears white in radiograph. And what is the benefit of radiopacity? That they helps us to distinguish caries from lining material. This also helps in diagnosis of the caries, current or recurrent caries. They must be compatible with filling material, as a new technique for achieving bonding and marginal seal of amalgam. So new techniques and new approaches, that amalgam should be condensed or freshly mixed and placed either zinc oxide phosphate cement, glass ionomer cement, or chemically active methacrylate based luting agent. Now requirements of luting agent. Many requirements are there in ISO 99171 dental water based cement and ISO 99172 dental water based cement light activated cement. Both are water based cement, but type 2 is light activated cements. Now fixing of indirect restoration to luting agents is nowadays in practice for porcelain and metal crowns, bridges, inlays, and metal posts. Metal posts are like the metal pins, which we have uh, discussed earlier in this lecture. Dentinal pins. So now lining agent and base agents are same. Ideally, they should be non-irritant, but it's not critical because we are using zinc phosphate cement also, which is considered as irritant. We are using zinc oxide eugenol. It is also a irritant, but they say that it is less irritant. Long working time, sorry, long. It's always our requirement that we have a long working time and short setting time. Low initial viscosity or a pseudoplastic material. Cement fluid must flow initially for proper seating. Initially, it should be more fluid and ideally provide thermal and electrical insulation. These two insulations are must be a property of a cement. Now, incomplete seating, if we see this picture, you can see this crown is fully seated at the areas. And here it is not seated completely. You can see there and there a large gap. And again, you can see D is not fully seated, while our C is fully seated. A and B, it is the failure of seating a crown during cementation, as the geometry of the crown is different. Here we can see a shoulder and it is a chamfer. So it is fully seated and it is not fully seated. Again, it is fully seated and it is not fully seated. If you can see, this knife edge is also somewhat above, and this is more, there is more widening or more space between the crown and the tooth. And here you can see a uniform space into the between the crown and the tooth. Same is in this picture. So A and B having shoulder, and C and D having the knife edge margin. And if we see the seating, a uniform seating there, A and C, and in B and D you can see a non-uniform seating. Now, mechanical retention. As we have made a crown, so we have to cut the tooth with a diamond bar, cutting bar. So as it rotates around the tooth structure, there will be a structure like this, and of this structure we have taken the impression. So the surface of inner surface of the crown also reflects the crisscross structure like we have created through the cutting bar on the tooth structure. So these two surfaces appears like this. So when we have to put our luting agent, it will hold the tooth structure, or will react with the tooth structure, or uh, add, will have a adhesion through these pores, you can say, or cavities, to the tooth structure, and same material will undergo to the inner surface of the tooth crown preparation, which also be created by sandblasting or other mechanisms when they are preparing crowns. So there is a sufficient room, and this type of surface is there which can facilitate the bonding of two materials. Two materials mean two structures, the tooth structure and the crown structure. Now the requirements. Seating of the restorative depends upon the film thickness, and it will be strong enough to resist fracture under loads. Obviously, low solubility, which causing resistance to dissolution or erosion, lead to failure by loss of retention. Low solubility mean it should be soluble. Is it? No. low solubility of the material. If low solubility is considered, it means that its solubility is low, mean it cannot be soluble. But low solubility of the material causes dissolution or erosion, and it leads to failure by loss of retention and initiation of caries, especially adjacent to the eroded lute. Clear? Now, requirements of endodontic cements. Endodontic cements are also used when we are going to do our root canal treatment. So whenever we are going root canal treatment, we are using endodontic cements. Now, removal of the pulp followed by preparation and disinfection of the root canal, and that root canal which filled using a combination of an inert filler, most commonly gutta percha, and a cement as a sealant of low viscosity, that is flow. It is mandatory. Resistance to dissolution should be its property or requirement. Good sealing ability, biocompatibility, setting should not be affected at mouth temperature, can be used in moist environment, and much prolonged working and setting time than needed for other cements. Requirements of orthodontic cements: attachment of bands and brackets. Band and brackets you have seen, which appears on a patient who is undergoing an orthodontic treatment. The brackets which you can see when he talks or laughs. Then these attachment of these bands and brackets should be easy to place and remove without damage to the tooth structure. If band or bracket is damaged, it's okay, but it's also not desirable to damage the band and bracket. But prime importance for the tooth structure, and easy to clean the remnants of the cements. It also provides protection to adjacent tissues. Rheological properties also allow fluidity for loading and positioning. When we are positioning and placing the brackets, cement have pseudoplastic or Bingham property. Here in orthodontic, it requires pseudoplastic or Bingham properties, not in other cements. Rapid setting in case of light cure. In case of chemical cure, we need somewhat delayed setting and an adequate bond strength. Thank you very much for your patience. This chapter also finished, and I think here again, if somewhat time is there, low solubility causing dissolution or erosion. Think upon this, that low solubility means solubility is low. How it can cause dissolution or erosion? So it is not the low solubility, it is the material with solubility levels which are very much low, that it can easily be soluble. So we can say that high solubility, not low solubility. It should be the most appropriate word. Think upon it and tell me your valuable comments. See you. Allah Hafiz. Assalamu alaikum.